Have you ever had any genetic testing done? Do your parents have Alzheimer's? Does your mother and grandmother have breast cancer? Is this something that you've been thinking about doing? If so, definitely stay for this entire podcast. I'm welcoming Natalie Samson. She's an integrative board certified genetic counselor dedicated to advancing healthcare through personalized, proactive, and integrative genetics care. She's earned her master's degree in human genetics and genetic counseling from Keck Graduate Institute, and it has completed additional certification programs in integrative healthcare, nutrigenomics, and functional medicine. She's founded her private practice called Golden Genetics to bring this holistic and evidence-based approach to genetic counseling and testing. In this episode, she talks about stories where people got their testing done and literally changed the trajectory of their life. It saved one woman's life. So you definitely want to stay tuned for this episode. Let's jump into this podcast. Natalie, welcome to our podcast here today. So glad to have you.
Thank you so much for having me. I'm excited to chat.
I was thinking about why would I bring on a genetic counselor on to Move Daily Talks? Like, it's not really, is it fitness, wellness, and nutrition? That's kind of our three pillars. But of course, all of the women and men listening want to live long, but not just longer. They want to live healthy. They want to live well. And so I know that genetics plays a big part of that. I've heard that old adage that genetics loads the gun, but lifestyle or epigenetics pulls the trigger. What do you think about that phrase?
Yes. Okay. So actually, when we talk about the subject of nature versus nurture, I always say that it is actually both, and it depends on what we're referring to. So when we think about genetics, we have certain genes that are very impactful in our bodies. And if we have a change in these genes, that can lead to a genetic condition. So many people have heard of genetic conditions like Down syndrome or cystic fibrosis, Huntington's disease. So obviously, if you have a genetic diagnosis, there's less we can do about it environmentally to change or alter that diagnosis. However, majority and many of our genes and gene changes fall on the other side of the spectrum, which we call low penetrance in genetics, which means that our choices, our daily habits really influence how those play out. And so we always say that in our practice, we say your genes are your starting point, not your life sentence. Because I think a lot of people think that when we're doing genetic testing, we're just telling you that you're doomed, which is actually, it's the opposite. Where, our goal is to help you feel empowered so you can take steps that's personalized and proactive to you, which I'll probably get into more later. But really, when we answer that question and that phrase, in our practice, we say it actually is both nature and nurture.
Well, I think that getting genetic testing done or understanding that a little bit more informs you, right? It's like going to get a blood test done. If you never know your numbers, your starting point, your blood pressure, your iron levels, then you don't know what to do different, right?
Exactly.
So it informs you, and that's a good starting point. I'm curious, like, how does someone like you end up in this field? There must be a story behind that.
Totally. This is such a niche field. So I always get the question when I say I'm a genetic counselor, everyone is like, what does that mean? Do you make designer babies? Do you do ancestry genetic testing? And I'm like, no, neither of those things. So genetic counseling really stood out to me because of the intersection between working with people and psychology and science together. I always had this desire to understand the human body as small as we can get on a micro scale. And so when I started studying genetics, it was so exciting to me. In my undergraduate degree, it was biology, and I had no idea what I was going to do with the degree. I really didn't want to go med school, but I just knew I loved science. And there was actually a woman who came to talk to us who was a pediatric genetic counselor who worked with patients with autism. Growing up, I had a brother who was neurodivergent and diagnosed with all sorts of things, autism being one of them. And so it really stood out to me. I had this kind of aha moment where I was like, oh my God, I can work with patients and families that are similar to my own, but also study very specific and micro scale science. And so when I went to pursue the degree, I did actually go in thinking I wanted to do pediatrics. But when I was studying genetics, I actually had this realization how genetics can help us be proactive and personalized with our health. And that stood out to me even more. So I switched into cancer, and I was doing cancer genetic testing for a little bit, and ultimately just loved the field as a whole. But I felt like something was missing in cancer when we were thinking about the ability to be proactive. And so anyways, that's what led me to start my practice. But I really wanted to go into genetic counseling because of that intersection with human and science.
We have a lot of interest within my own family about genetics because we have a bunch of people who've been adopted. And so they don't know their genetics, right?
Yeah.
My husband, for one, was adopted and has no idea what his, past, he hasn't met his birth parents, so no idea, what is in store for him almost. And so it can make you really tentative and afraid even of what the future might hold. So, understanding that is good. I know that 23andMe and the Ancestry DNA also brought, a whole host of children all over the world that were related to other people. And that happened in our family as well. It's like,
Well,
oh, you've got brothers. And I'm like, wait, what? So
yeah.
it's like, it's a new thing. And so I think my generation and my parents' generation, adoption and different things like that weren't talked about as much and kept quiet or under the rug. But people were interested to know their history and their past and their genetics. And so they began, these sorts of testing and opening the field up for just a whole host of people to come forward, right?
Yes. Yeah. We always, genetic testing really started in the healthcare space in prenatal. So many women have heard of genetic testing through pregnancy. And as we started to uncover more of what our genome means, meaning understanding the genes in our body, genetic testing became more accessible and actually cheaper to sequence. And we started learning more and more about genes. So we started ordering more and more genetic tests and genes in those panels. But then direct to consumer companies that test for ancestry came out. And that was the first time genetic testing switched from a healthcare setting into the public. And so it was really interesting for the genetic testing field because it was, on one hand, amazing because now everyone knew about genetics and everyone wanted to do genetic testing. So obviously, it became more talked about, which is so helpful. But on the other hand, it kind of led into a lot of misinformation as well as kind of, unfortunately, genetic tests that aren't the best when you're doing health genetic testing, which we can get into too. But so we always say when we're doing genetic testing, we're doing genetic testing for health, and the other thing is that your data is under HIPAA, so it's protected, and there's privacy laws. Whereas when you're doing genetic testing, not outside of healthcare, there's a lot there. So, but that being said, not all direct to consumer tests are bad. And we always say like ancestry genetic tests is kind of its own thing, different from health genetic tests. So it's, depending on what you want to test for, but it was such an interesting evolution.
Yeah, an interesting time for sure. Like we just had never seen that before. Let's talk about the difference then between the health testing for genetics and then just this lifestyle or familial testing.
Yes. Okay. So, and that's actually something that makes our practice very different because when you're studying genetics as a genetic counselor, you're studying medical genetics. So that would be diagnostic or high risk genes. So like we were referring to earlier, this could be preconception, disease risk like cancer or Alzheimer's and dementia, early onset Alzheimer's, things like that, pediatrics, medical diagnoses most of the time, and then increased risk, but to a higher risk. So that's like the BRCA genes. Many people have heard of the BRCA genes. So we study those as genetic counselors. And there's another world of genetic testing. This is where the low penetrance genes come in. We like to call it in our practice functional genomics, but it's also called nutrigenomics. There's a lot of different SNP-based testing, all of that world. And for us, you have to be careful when you enter that world because there is a lot of kind of marketing schemes and salesy things happening in that world that maybe isn't accurate for health. However, when you really study it and understand it and work with someone who understands genetics, you actually can get so much good information and data in that world. And so most of the time, that's where the direct to consumer world falls. And so we have a love-hate with that world, because some tests are amazing and we use a very reputable test in our practice in that space, but some tests only test for maybe 4 genes, and then they charge $1,000 and give you a protocol
Right.
that may not actually make sense for you. And so and then when we're on this side, we don't want to exclude this. I know the listeners can't see my hands, but if we're thinking about like high risk medical diagnostic testing, we don't want to exclude that from being important. If you do have family history, of a certain condition or disease, again, like we talked about, there's so many ways you can be proactive, especially when it comes to cancer. So usually the direct to consumer tests aren't including the medical tests, and the medical tests aren't including the functional genomics. And so
Right.
in our practice, we combine both, but you just have to be careful in the world of genetic testing in the functional genomics space.
Mm-hmm. What are some of the types of medical testing do you do?
Yeah, so we like to call ourselves general genetics, meaning we cover everything and more. We're like a one-stop shop for, basically we can help you with any genetic test besides prenatal. So that means if a woman is pregnant currently, we can't test baby's DNA. But medical genetic tests would be, so the other genetic counselor that works in our practice works mainly in pediatrics. So that's genetic testing for children. That can be for developmental delay or autism diagnosis, anything medical for peds that meaning children that they can't figure out a diagnosis. We both work in preconception. So if someone's getting ready to start a family, we can do things like carrier screening. So that would be assessing both partners or the couple to see if they could pass anything down to their offspring, even though they don't express anything. It's called recessive inheritance. So we'll test for carrier. We also test for cancer. So I love genetic testing for cancer. And everyone's like, I don't know, I think we get a lot of hesitation when it comes to cancer genetic testing. But I think something that people don't realize is that if you have a cancer gene change, you're not at 100% chance to develop cancer. And so that's why in our practice, we love to talk about preventative proactive care, because from a medical standpoint, that could include screening, surgeries. If that person, there's a lot we can do with screening and surgeries if that person chooses those avenues, but there's also a lot we can do when it comes to nutrition, lifestyle, and supplementation to be proactive. So we always help, our goal is to make people feel empowered and not fearful of the results. And something to note on that is the BRCA genes are only 2 genes, and we've now identified over 70 genes related to cancer risk. And so a lot of people come to us saying, oh, I've already done the BRCA and I'm negative. And we always say, well, actually, we've identified so many other genes we might want to rule out, or assess for you. So that's something we see all the time.
So you're talking about, like I've heard some celebrities, only just because it's been in the news or whatever, they have the gene for breast cancer, so they get a double mastectomy just in case. I think didn't Angelina Jolie do that? Someone like that.
Exactly. Yeah.
Okay. Yeah. What other sorts of preventative and protective care can we do in order to, stave off the likelihood of getting cancer if we have one of these genes?
Totally. So it is gene dependent first. So we do want to assess what gene is in question. The BRCA genes are very different than if you have a colon cancer gene, for example.
Can you explain what the BRCA gene is? I don't even know what that is. Okay.
No worries. Okay. Yes. I know a lot of people have heard of.
I have heard of it, but I'm like,
okay. But it's not, it's very misunderstood. And the reason people have heard of it is because of just the actresses in the news. So there's a lot more to it.
Okay.
So the BRCA genes are actually genes we all have in our body that are supposed to protect us against breast cancer, ovarian cancer, pancreatic, and prostate in men mainly. And what happens is when we have a change in one copy of those genes, because we have 2 copies of each gene, we get one from our mom and one from our dad. So if we have a change in one copy of the BRCA gene, then we have an increased risk because we have less protection against those cancers. So that's something we hear all the time. Many people think it's, do I have the BRCA gene or not? But it's actually, do I have a change in that gene that can cause that gene not to work as well? Okay. And so if you have a change in one copy of one of those genes, then from the medical conventional side, screenings and surgeries come into play. So the reason that people end up electing surgery is because, of course, it's called prophylactic surgery. If you remove, for example, your breast tissue, then you're removing your risk of cancer developing, for breast cancer. However, not everyone chooses surgery. So there's a lot of other things we can do. So in the medical conventional world, again, screening is the second thing. So that would be important to catch anything if it does come up early. And I always say cancer caught early is a much different story than cancer caught late. We've all heard of people, if you catch cancer at stage 0 or 1, it's usually a quick surgery. If you catch cancer at stage 4, it's usually chemo, radiation, and surgery, and no promise that that works. So that's why catching cancer early can be so helpful. And that's where proactive screening, such as mammograms or breast MRI, can come into play. And then we have the more holistic side of things. And so something that I just fell in love with is understanding how we can utilize nutrition, lifestyle, supplements, and what the research is saying to be preventative of those cancers. And there's so much we can do that we've identified now. And that part of the conversation I felt like was oftentimes missing in the conventional space. And so nutrition and lifestyle, this can be things like, of course, we want the basics. So like general healthy eating, movement, sleep, and stress, right? Those are always essential. And then we can actually utilize the functional genomics test to optimize that even more. So for example, we test for inflammation and detoxification genes, as well as histamine and glucose and insulin, like a lot of different pathways. So if someone has a increased risk of breast and ovarian cancer, for example, then we also want to assess what nutrients can we use to prevent and be proactive about those cancers, and what are the other genes saying. So if a woman has high inflammation versus, maybe she has good, glucose and insulin, but she's spending all this time managing her blood sugar. But in reality, maybe her blood sugar is actually pretty stable if she's not wearing a CGM and she doesn't know. Then we want to focus on inflammation. It's optimizing beyond the basics by using both genetic tests.
I'm guessing not everyone needs to do this. Some people probably couldn't afford to do genetic testing, but who would you recommend this for specifically? Like, do we look at our family history and kind of go, okay, my mom's had Alzheimer's, my dad's had Alzheimer's. Am I at a higher risk for Alzheimer's? Like I think about Chris Hemsworth had that genetic testing done, and then they did a documentary on him. For those of who don't know, he's a celebrity, and he had
ApoE. It's called ApoE. Yeah.
Okay. So let's talk about that. Who's it for specifically? If, if we're looking in our own backgrounds, at our own history, our own families, what are we looking for in order to say, you know what, maybe it's prudent that I get this testing done?
Totally. Yes. So I think there's two pieces. The first is if someone has a family history of certain conditions like cancers, and I'll get into that more because cancer, if you have a family history of lung cancer or liver or kidney, those are usually environmental and not genetic. So usually we're looking for things like breast cancer, ovarian cancer, colon cancer, pancreatic, prostate, and other rare cancers too, like stomach. But if someone has family history of cancer or Alzheimer's, like you mentioned, dementia, there's other conditions too, like connective tissue disorders, Ehlers-Danlos syndrome. So family history, when we're talking about family history too, not a lot of people know about their family health history. And so when you're thinking about, okay, what's information that I should know, we're usually thinking of 3 generations max. So if your great grandmother had breast cancer, it's not as important as if your mom was diagnosed with breast cancer. So part of what we do as genetic counselors is we always have a pre-test session to review family history in detail, but something you can keep an eye and ear out for in your family history is parents and then grandparents and then aunts and uncles. That's really, and siblings, of course. So we want to assess. And then also when it comes to family history, we really want to think about if it's coming from one side. So like mom was diagnosed with breast cancer and then her mom was diagnosed with ovarian and mom's sister was diagnosed with breast, versus mom was diagnosed with breast and then maybe dad's sister was diagnosed with breast. That actually, because genetics falls down into a vertical inheritance pattern, we say, like below generations, we actually pay more attention to if there's family history clustered on one side of the family and in multiple generations. So that's one piece. And then I'll just say the second piece is we have found clinically that so many people benefit from genetic testing who have complex autoimmune or chronic symptoms that they feel like they've gone down the rabbit hole with every test and nothing has been, there's no answers. And we've always found that genetic testing can really be helpful. So those two, I would say, would be, ideal candidates. And I also like to mention a lot of people don't realize that we can use insurance or financial assistance for some genetic tests, especially when there's family history. So that's something, I think we definitely are unique in, because we always really support the patient in lowering the bill of the genetic test as much as we can to make it accessible and affordable. Whereas if you ordered on your own, you might pay thousands of dollars. And a lot of times for example, we have our patients for cancer genetic testing pay on average maximum $250 out of pocket. So really lowering it as much as we can.
Well, that's good to know. You said, why autoimmune? You were just talking about the two, cancer but autoimmune disease as well. I'd love you to explain why that is genetically predisposed.
Yes. Okay. So autoimmune diseases are something we call multifactorial, which means they're not as black and white as medical diagnoses of genetic conditions, but genetics does play a role. So we have a mix of genetics and environment, and that's what multifactorial means when it comes to autoimmune conditions. When we're thinking about genetics, though, it can be so helpful because autoimmunity can be really hard to diagnose and understand what the root of the symptoms is. Yeah. And so, for example, we've had patients who have done genetic testing, and through genetic testing, we were able to identify that they actually have a diagnosis of celiac disease, as well as they have issues breaking down histamine. I think many people are hearing about MCAS lately, but that's an autoimmune condition where you can't break down histamine. So for that patient, she was eating gluten. She had cut dairy because someone had said, cut dairy, it's inflammatory, but she was still eating gluten because she didn't think that was her problem. She tested negative on a different gluten test. So she was like, okay, I don't have it, which actually doesn't rule it out. So she didn't know that information. And then histamine, for her, she was eating a bunch of fermented foods because she was having such GI issues, and she was given probiotics and fermented foods. But when you have histamine breakdown genes, it actually makes it worse when you eat fermented foods. So she was,
who knew?
Yeah, exactly. Right. And so she was causing herself to have migraines and chronic diarrhea and worsening her GI issues. So for her, it was like life-changing information, because once she cut out gluten and histamine, she had emailed us like a couple weeks after saying that most of her symptoms have resolved. So it was so helpful. And she knows when you have an autoimmune condition, you know that you're a little bit more sensitive to the world, but now she identified what to do.
I've heard of this eat for your blood type diet. I know my mom has gone to it before. To me, it seems a little bit hokey. It's like if you just ate healthy foods, diverse, a wide range of whole food selection, you'd probably do okay. I think for some people, it's like their lifestyle is crap and their choices are crap. And so when they follow a diet, of course they're going to feel better. But is this different than that? Like, is that just, I don't know. I'd love for you to explain that, because that kind of just came into my head. I'm like, okay, are we just doing things, just to make some monumental or microscopic shift? I don't know. Go ahead.
Yeah, it's very different.
I figured, but explain how.
Totally. When we're doing genetic testing, we're looking at what you're born with, the information that's giving you your body instructions for your whole life. And we're looking at, we have 20,000 genes in our bodies. And so when we're looking at genetics in that situation, we look at over 200 markers, and we're looking at genes, how they work in like a biochemical fashion. So it's not, the way I view blood type diets is that that's only one marker. And I don't personally think there's enough research and data to be able to tell if that one marker actually controls how we break down all different types of nutrients and respond to different foods. When we're looking at genetic testing, I also like to say that healthy diet, like having a generally healthy diet, is key first. Genetic testing helps us optimize. And so when we're thinking about how we're eating, we're looking at the biochemical processes of how you're literally breaking down what you're consuming and responding to it. So for example, another example is the ApoE gene that we were talking about earlier. ApoE has been associated to increased risk of Alzheimer's, but we also actually know that it's responsible for breaking down fat. And so if someone has a certain variant, then they're very sensitive to saturated fat, and they're also sensitive to have high cholesterol.
Mm-hmm.
And so, that's why if someone's eating generally healthy, but then they have ApoE and they have a high cholesterol, we want to also talk about like, okay, how can we get in different types of fats? And that's why also we don't love trends, because someone could be eating keto and have ApoE and eating a bunch of saturated fats and
like,
ruining their heart. Yeah.
You're like,
And
your
so
cholesterol is just going higher and higher and higher.
exactly. Yeah. And so we are looking at how things are being processed on like a microscopic scale, and then like personalizing it is the word that we like to use. So instead of having you just try different trends to, see if it works for your body, then we can actually see like, okay, this probably isn't going to work for your body.
We had Dr. Stefan, she's a gerontologist, and talked all about the Lancet Commission and the 14 modifiable risk factors for dementia and Alzheimer's. And they were all lifestyle related, of course, but I still want to stay on this topic of dementia and Alzheimer's, because my audience right now, this is what's happening to our parents, right? And we see it happening. We just don't want it to happen to us. And so if someone were to come in, maybe both their parents developed Alzheimer's or dementia, what do you do? What's your starting point? What's the protocol? What are some of the lifestyle changes you make, or are there prescriptions or supplements that people begin to take because if they do have the ApoE gene, not much you can do about it at that point. Am I right? Or yeah, go ahead.
Yeah. So the first thing we want to do though is test. And the reason is because even if both of your families developed Alzheimer's and dementia, that actually still doesn't mean you inherited the risk.
True.
So I always say, some people, for example, I've had a patient who both of her parents developed, one parent developed breast cancer, one parent developed prostate cancer, and she just assumed, okay, I'm at risk, I'm doing the screenings, I guess let's just test to figure it out. And we actually found out that she didn't inherit either gene copy from either parent, even though her parents had increased risk genetics. She didn't inherit it. And so then she was actually really relieved and didn't have to do the screenings that she was doing, because we call that a true negative.
But
So
could one of her copies change?
no.
Okay. So it
Yeah.
only changes if you have a genetic predisposition, if you have the gene. It only possibly. So let me just
I know
sorry.
you're asking.
Okay, go
Yeah.
ahead. You explain, because I'm like, okay, go ahead.
It's very confusing. It's epigenetics, which is like its own world.
Yeah.
So when we're born, we have genes that are spelled a certain way, and you can have a spelling change in one or both copies of your gene. That spelling actually never changes throughout your life. So you're born with maybe a predisposition to this, or just a different, eye color. Sometimes it's just human diversity. And even though that genetic change will not change throughout your life, the way that it is expressed changes, which is kind of like, the way I like to describe it is, if you're reading a book and we have certain chapters of the book, and then in one chapter, certain sentences are kind of misspelled. And so that makes the reader a little bit confused on that in that chapter. However, what can happen is we have post-it notes that flag that part of the chapter or not. And that's what epigenetics is. It's as if we're saying, read here or don't read here. And so again, it depends on what gene we're talking about. Sometimes the spelling change, epigenetics actually, it's part of development, so it doesn't work that same way. But many of our genes, you can remove post-its off and on. And so for that patient who had cancer in both parents, because her parents identified that they actually had the genetic increased risk, and we identified that she didn't inherit it, she then is down to population risk, because she, her genetic changes, or her genetic spelling won't change.
Okay.
So when it comes to Alzheimer's, yeah, that's why I always say test first, because sometimes we rule it out for you, which is amazing. And then if something comes up, so ApoE in specific, let's talk about that gene because it's kind of a movie star gene. There's certain movie star genes like ApoE, MTHFR, the BRCA genes that many people have heard about online.
Sure.
ApoE is, even though it increases risk of Alzheimer's, it's not 100% diagnostic. And so we have early onset Alzheimer's genes that work a little bit differently. Those are much higher chances of developing Alzheimer's. But if you have an ApoE gene change, you're at increased risk, but that does not mean you'll develop Alzheimer's.
Mm-hmm.
So that's when we want to use information like the modifiable risk factors and things like how can we optimize your diet because this gene processes fat? How can we keep your inflammation down? What are things that we can do? And then there's so many different tools out there now that can help us, be proactive and reduce our risk. So we would personalize that information for that patient if that does come up. But I always say, because that gene is not a 100% diagnostic gene, it's more like research is kind of still being debated, but 10 to 60% increased risk. And so, of course, we'd identify where you fall in that range, but it's not as high as I think people realize. So it's not like you're doomed if you have that. There's a lot you can do.
Yeah. Yeah. Well, and I feel like that's true with so much, their healthy lifestyle will take us such a long way. It's just a matter of us doing all of the things and dialing that in. We hear a lot about, maybe longevity genes or obesity genes. Is there some credence to those two things?
Yes. So there have been identified longevity genes, but I always like to say that if you have a longevity gene, that might increase your chances to live longer in terms of just age, if we're just thinking about a biomarker of age. But that doesn't necessarily qualify your health span. So you were kind of mentioning this earlier, meaning how well you'll live. And so if you do have a longevity gene, we still have to pay attention to other genes, like how are your cardiovascular genes or cancer genes, but also how are you living and like your lifestyle, because of course you can potentially live a really long time and not feel your best. And I think everyone can agree that the goal is really to live a long time and be able to be independent in those later years and run with our grandchildren. So, when it comes to longevity, and obesity genes are a little bit also more complex. There are genes that can predispose individuals to hold on to fat longer, which is actually pretty common in evolution because most of our evolution, we were in starvation states. So we wanted to hold on to fat. So we see this all the time with patients. But again, this is where lifestyle and environment and what you do really impacts that. The one thing I will say is the glucose and insulin genes can be really helpful though, because someone might be predisposed to high highs and low lows when it comes to blood sugar spikes and drops. And that's a very reputable pathway to test for. And so if that comes up for a patient, then we know, okay, blood sugar balance is essential for weight loss. And then there are many companies that offer those two, genes in those two categories that make no sense. So you really have to be careful on what genetic test you're choosing, but there are genes we've identified in both categories.
What about mental health? I'm thinking anxiety, depression, psychosis, schizophrenia. Where do our genes come into play with mental health?
Yes. So mental health is very similar to mental health is very similar to autoimmune conditions. So thinking multifactorial.
Right.
So we do have genes that help us understand how you process and break down dopamine, your dopamine receptors. We have genes that help us understand how you process serotonin, adrenaline, oxytocin, a lot of genes in that category, which is so interesting. But we also know in research that if someone is born with a predisposition to maybe have dopamine imbalance, but then they have a very traumatic childhood, they're more likely to develop, mental illness than maybe someone's predisposed to that, but they don't have that same experience. They might have a little bit more predisposition to anxiety regularly, but it's not, a diagnosis of, something. So that's what's also really interesting in research is what's happening. And environmental, when I say that too, that could mean stress and like traumatic events and food and, what things are you're being exposed to potentially. Like, did you grow up on a farm with lots of pesticides? Like there's so much to take into account when it comes to environment, but that's how we view mental health and genetics. So it can be really helpful to test. And we always talk about, we want to make sure it's in context and get the whole timeline picture.
Yeah, I think of the ACE factors, which acute childhood experiences, and how that will write on the slate of your, how you manage your mental health. But also, the child is going to be parented by the parent. And if they have depression or anxiety, they grow up in an atmosphere and an environment where that's all true. So it's almost like a double whammy, right? You've got environment and experience and parenting in combination with what's happening internally, genetically.
100%. Yeah.
So I did your online quiz. Natalie has a good little online quiz where you can begin to see, sort of what's in your genetics and whether testing might be right for you. I got the little results back. I just wanted to share them here and then ask you a follow-up question. So basically my results were to continue supporting the basics, including sleep, nutrition, movement, and stress care. Pay attention to subtle patterns in energy, focus, recovery, and resilience. And then review family history and note any patterns worth keeping in mind. So my question is, what can our patterns tell us about our health?
Yes. Okay. So when it comes to symptoms, I always like to say are you experiencing a symptom regularly?
Yeah.
So just any symptom that you can think of that doesn't seem right. And I always like to tell patients that there's probably a root cause for that. A lot of patients come to us, thinking that that's their new normal. Like maybe they have constipation and they only use the restroom once a week. Not normal. There's definitely a reason for that. Other patients are saying, I've had brain fog and migraines on and off on like maybe a weekly basis, also not normal. So paying attention to things that are coming up regularly. And if you're assuming they're normal, just as an empowering note, there's probably a root cause that we can help figure out. And then other patterns, right? I think the most important when it comes to medical genetics is sitting down and having a conversation with your family next time you're with them about family health history. Because even me, as I was studying genetics, I actually had an assignment where I had to take my family health history, and I found out so much information that I didn't know about any of my dad's side. And of course, if you're adopted and you don't have this information, that's totally okay too. We see patients all the time who either are adopted or do not have family health history. They don't feel comfortable asking their family those questions. And that's totally normal and fine. And that's where we can talk about genetics, helping us get personalized and proactive with your care. So those are the two I would pay attention to. And we always say in our practice that there's 4 P's that genetics can help with. And you can take this quiz as well. We love our quizzes. So it can give immediate direction. Proactive, or the 4 P's are proactive, preventative, personalized, and precise. So genetic testing helping us in those 4 buckets. Proactive being, can we catch anything early if it does come up? Preventative is, can we prevent things from happening in the first place? Personalized is what's actually working for you and, your unique biology. And also personalized comes in with prevention, because let's say someone's like, oh, my friend has had breast cancer and I'm doing everything I can to prevent breast cancer. But maybe for them, they don't actually have to worry about breast cancer. They actually might want to focus their energy in, diabetes prevention. And then the last is precision. So precision is how we can use genetics to personalize treatment. So a lot of people don't realize that there's genetic tests that can help us personalize our medications. It's called pharmacogenomics. It's a really interesting test. There's precision in cancer care now. Most people who do actually have to use chemotherapy will often do a genetic test first to assess if it's the right one for that cancer. So fascinating stuff in precision medicine. And so those are the 4 P's to pay attention to too, if we can help optimize those with genetics.
Have you ever had a client who's done genetic testing that has, because of the testing and what they learned, has shifted the trajectory of their health and life?
Yes. So one story that comes to mind that is amazing is we've had a patient who we identified to have a change in a gene that does actually increase her chances of ovarian cancer. And she did actually ultimately decide, after she had children, to remove her ovaries. While they were going through that surgery, they actually found stage 1 ovarian cancer and was able to remove it. And many people know that ovarian cancer is usually caught late because it's hard to detect. So that was, one where genetic testing actually really saved her life. And again, that's not always the story or the case, and it's not required to do surgery if you have a gene mutation, but in her case, it did actually turn out to save her life. And then I would say other patients that we've just had, for example, the patient I mentioned before, understanding she was celiac and histamine, even though those are, I would say, less high risk genes, they were so beneficial for her to understand because it fully changed the way she showed up. She actually texted me saying that she's a better mom, she's a better friend. Like, it fully made our day because she didn't realize how much her brain fog and her GI issues were really impacting her relationships and her everyday. So it's obviously our favorite part of the job is helping people find answers. But those, I think, would be two big examples.
Yeah. Well, it's true. We just plug through our day, sometimes feeling less than optimal, but we just think that it's normal, or I don't know, we don't spend the time going, okay, it doesn't have to be like this. We could figure out exactly what's going on here. Looking ahead, where do you think personalized genetics will fit into our healthcare over the next 10 years? I'm sure you've seen some new developments with AI even in the picture here. So let us in on your world a little bit there.
Yeah, so I think that genetic testing will really actually start to be the norm for everyone because I think we're realizing how a one size fits all approach doesn't make sense.
Yeah.
And, really being able to personalize and then also shift out of reactive care when we have the tools to do that is so powerful. We're seeing genetic testing being used in more of the conventional traditional space, like I mentioned, in medication choice, but also precision medicine with treatment. And then we're seeing functional genomics being used among dietitians and optimizing how dietitians work with patients. We're also seeing genetics in a research standpoint. Gene therapy is very interesting. It gets a bad rep because it sounds very scary and abstract. However, being able to understand gene therapy, meaning how we can alter the gene. So like I mentioned, most of the time we can't change our genes once we're born with them. They are our whole life. But we now are developing medication that can alter our genes as we're already born. And that's being used in disease prevention, like sickle cell anemia, for example.
Right.
And muscular atrophies. So, amazing research being done there to help patients who are born with diseases and, assumed that they had no choice and assumed they knew how they were going to pass away. And now we have, support and treatment to alter that. So I think that's incredible. So there's so many different directions. Genetics is such a rapidly evolving field right now. And I think obviously a little bit biased, but the key is making sure we have genetics experts and people in this space, and working with someone who understands genetics is really key because everything needs to be put into context. And AI can be so helpful in understanding and the research side of things. But I always warn people not to plug in their DNA into AI for many reasons, but one being AI has actually gotten things wrong. Like when I've tried it and experimented and ChatGPT told me the wrong things. They were like, this variant says something bad. And I said, no, it's actually good. So they were. And then the other thing is AI obviously can't put it into context. So obviously working with human healthcare professionals, we're able to see what season in life are you? Are you perimenopause? Are you preconception? Those are different, totally different seasons where you're going to need different recommendations, even if you identify similar things. So putting into context, what are your blood results? What is your history? All of that with your genetics is important.
I'm glad you differentiated between your types of genetic testing and even the Ancestry or 23andMe and just how different those two things are. I mean, one is good for like build your family tree and figure that out, right? But this sounds far more medical and what diseases do we have going on? Can we prevent those things? And really focusing on that prevention aspect. I'd like to finish with a little bonus rapid fire if you're up for that.
I love it.
Okay, so just say what comes to your head, but I probably will get you to expand on many of them because it's usually like, why do you think that? Okay, here we go. Nature or nurture, which matters more?
Okay, both. And which matters more depends on the gene in question.
Right. Okay, good. What's one genetic test that you think is overhyped?
MTHFR and methylation testing.
Okay, explain those because I'm not sure what those are.
Okay. MTHFR seems to be trending on Instagram. So
Okay.
that's
Yep.
sometimes I'm like, is it my algorithm or everyone else's? But
Yeah.
we've had enough patients come in asking about this test. So MTHFR and methylation is biochemical pathway in our body. And there is genetic tests that you can do to assess if you should take things like methylated folate, methylated B12, or choline, especially during preconception, but also in life. And there was unfortunately a lot of misinformation going around that this one gene, any changes in this gene can cause things like autism, cardiovascular effects, miscarriage. But we've actually identified that through research that's not true, that there's so many other genes we want to take into account, and professional organizations like ACOG and ACMG actually don't recommend MTHFR testing anymore for those conditions. And so from an integrative holistic perspective, methylation testing can be helpful to identify which supplements to take in what form, but we always say it's not a diagnostic test, and they oftentimes, there's a lot of misinformation there where they get crossed together.
What's one genetic insight most people would benefit from knowing?
I would say, well, not all wellness trends are universally healthy, and understanding what works for you personally can make a huge difference.
Oh, amen to that. There is so much online right now. I feel like because an influencer will say something, it will go out to hundreds of thousands of people, and then everyone in that audience thinks that it's pertinent to them.
Exactly.
Whether it be what to eat, how to move, how many steps to walk, it's like everything is just one broad brush stroke, and we think it applies to everyone. And this is the problem with social media at times. It's like everyone is individual, and everyone has to do what is right for them, for their body, for their timeline, their time in life, like their season. It is just, it's got to be very individualized, which is why we have to be the Sherlock Holmes of our own bodies, folks.
Yep.
Right? We can listen, but then we've got to do the deep work of investigation as well.
Yeah.
Can you out-train bad genes? Like we talk about out-train a bad diet. Can you out-train bad genes?
So for the majority of genes, we have lots of influence. So I'll say yes for the majority of genes.
Yeah, good. I love it. What's more important, your DNA or your daily habits?
Okay, love this. So something we always like to say is your genes can set tendencies or predispositions, but your daily choices are how they play out.
Okay.
So really it's daily habits and genetics together. And even when you have tendencies, the daily habits become even more essential.
Love it. And finally, what's one thing you wish everyone understood about genetics?
So, like I kind of said earlier, people think that genetics is about what you can't change or what you're going to be doomed to have, but it's actually the opposite. When we're doing genetic testing, it's helping us understand where your effort actually matters so that you can stop guessing and start aiming in your approaches.
Love it. Absolutely love it. Thank you so much for being my guest today. I think this was fabulous. And again, we want to inform our audience. We don't want people to be scared, but we want you to feel empowered to take charge of your health and move toward the healthiest version of yourself. Natalie, thank you. And where can people find you and or work with you?
Yes, thank you so much. And a comment on that too is we always start with an initial session before ordering any test. So you always can figure out the information and decide if you want to test moving forward. So that's something we always mention. So in working with us, we always start with a free logistics call with our team member, or you can actually book an initial session with us directly. Both of those links can be found on our website at www.goldengeneticshealth.com or through our Instagram bio at Golden Genetics Health. And my Instagram, if you want to stay in touch, is Genetics with Natalie. And I always say I welcome any and all questions, so please feel free to DM me as well.
Oh, I love that. That is very helpful. Thank you for offering that. All of her links will be in the show notes below. There was some quizzes they provided us, so I will also link those in the show notes. So make sure you jump down there, leave a comment, take a look at some of that information, follow Natalie over on Instagram, and check out some of the things that they have to offer. Thank you for being my guest today.
Thank you so much.
Now to all of you, go move daily in your fitness, your wellness, your genetics, and we'll see you all in the next Move Daily Talks.